Hi everybody. So today we will be seeing medical coding abbreviation interview question part 4. If you're watching my channel for the first time, please do subscribe. So these are the repeated questions which are frequently asked at the time of interviews. So you can take a note of all these questions in a book and you can go through it before you are planning to attend an interview. Now we'll move on with the first question. First question is, what does SOAP signify in medical chart? Option A, subjective, objective, assessment, and P for planning. Okay, option B is symptoms, observation, assessment, prescription. Option C, subjective, observation, analysis, procedure. Option D, symptoms, objective, analysis, plan. So this is all about the options. Now we'll move on to the second question. Second question is, what is the abbreviation for Hippa? What is the abbreviation for Hippa? So option A given here is health information, privacy and accountability. Option B, health insurance, portability and accountability. Option C, Healthcare Information Protection and Accessibility Act. Option D, Hospital Insurance, Privacy and Authorization Act. So read the question, read the options properly and answer the question. Now we'll move on to the third question. Third question is, what does EHR stand for in healthcare technology? So I'll repeat the question. What does EHR stands for in healthcare technology? Option A, electronic health registry. B, electronic hospital record. C, electronic health record. D, electronic health resource. So read the question carefully, read the options carefully and answer it. Now we'll move on to the fourth question. So the fourth question here is, what does HPI represent in medical coding? I'll repeat the question. What does HPI represent in medical coding? Option A, health progress indicator. Option B, history of present illness. Option C, health patient information. Option D, hospital progress index. So read the question twice, read the options carefully and relate to the question. Give your answer in the comment box. So the next question is question number 5. Question number 5 is, what is the abbreviation for RX in prescription writing? Option A, refill. Option B, reorder. Option C, recommendation. Option D is prescription. So what is the abbreviation for RX in the prescription writing? Refill, reorder, recommendation and prescription. So read the question carefully, give your answer in the comment box. So next we'll be moving on with the sixth question. So the sixth question is, what does TX signify in medical documentation? A, treatment. B, test. C, therapy and D, transfusion. So I'll repeat it again. What does TX signify in medical documentation? A is treatment, B is test, C is therapy and D is transfusion. Next we'll move on with the seventh question. So the seventh question here is, what does SX stands for in medical shorthand? A is syndrome, B is surgery, C is symptom and D is system. So I'll repeat the option again. A is syndrome, B is surgery, C is symptom and D is system. Next we'll move on with the eighth question. So the eighth question here is, What is the abbreviation for CBC in laboratory test? A is comprehensive blood test, B is complete blood count, C is cellular blood count, and D is central blood check. I'll repeat the option again. What is the abbreviation for CBC? Option A is comprehensive blood check, B complete blood count, C cellular blood count, D is central blood check. So next we'll move on with the ninth question. So read the question carefully and give your answer in the comment box. Ninth question is, what does MRI represent in diagnostic imaging? A is medical resonance imaging, B is magnetic resonance imaging, C is manual resonance inspection, and D is microscopic radiographic inspection. So what does MRI represent in diagnostic imaging? The option is given. So read the question carefully, read the options very carefully, and write your answer in the comment box. And finally, the 10th question. What does CT stands for in radiology? Option A is computerized tomography. Option B is centralized test. Option C is clinical testing. Option D is continuous tracking. So what does CT stands for in radiology? A is computerized tomography, B is centralized test, C is clinical test, D is continuous tracking. So read the question very carefully, read the options carefully, write your answers in the comment box. Thank you so much. So thank you for watching this video. If you haven't subscribed my channel, please do subscribe and wait for the next video. So we will be adding all the interview questions here. Thank you so much for your time. Take care.